Hey, Kathy, good morning. Good morning.
Good morning. How are you?
Good. So, Kathy, I'll cut right to the chase here. Of course, you're the director of Cheyenne-Laramie County Public Health. What's the latest on COVID-19?
Well, in Laramie County right now, we have 69 positive cases, so our numbers are definitely going up. We have a positive case in in Pine Bluffs, one in Alvin, and one in Burns, and all the rest of them are in Cheyenne. Unfortunately, this week we also experienced our first death. So that was a really sad event. We were hoping to avoid that, but we did have a death this week.
Now, is there any indication that the situation is moderating at all?
I don't think so. I wouldn't say it's moderating. No, we're continuing to climb at a fairly steady rate. I think we're about, 7, 8 a week that continue to go up. So it's still there, and it's definitely going up. We have over 170 people that we've placed in quarantine in the county because they have, these are individuals who have had close contact with a positive COVID-19 patient. So I think that also shows how contagious it is, that with those 69 people, 170 plus people have been put into quarantine. So it's definitely out there.
Now, we hear a lot about the curve flattening and flattening the curve. Any progress in that regard, or are we still, do you think, on the way up?
I think we're still on the way up. I mean, I definitely think that due to the social distancing, our slope up is not as severe as it could be. I believe that if we hadn't had the social distancing, the numbers we are seeing would be far greater. But we're still on the upward curve for a while.
Do we have any idea when we're going to see the peak here locally?
No, we've seen different sets of numbers. There's one institution in Washington State that's anticipating our date as April 29th. I've seen others the first week of May. I've seen one the other day that was May 15th. So we just really don't know at this point. Now,
of course, statewide, it seems to be on a bit of a different track than Laramie County. We've seen a lot of cases in our bigger counties here. Do we have reason to be, thinking that the track in the large urban areas, say Cheyenne and Casper, is running ahead of what we might see in, say, Niobrara County, and that they might peak later than we do, or do we know about those sort of things?
The Department of Homeland Security has a phenomenal website, and I wish I knew the exact address of it, but they have a great website that shows for each county how many cases we have per 100,000 population. And when you look at places like Teton County and Fremont County, their ratios are far greater than ours are. In Teton County, COVID-19 really started with a ski resort where some folks had come in to go skiing, and it just kind of took off out of there. In Fremont County, it was in a nursing home, and again, it just spread rapidly. So some of the smaller communities actually have a higher per capita ratio of positive cases than we do. We do have the highest right now in the state as far as just the raw numbers. Casper is only about half of what we are here. But we also anticipate that's going to go up because they had COVID-19 in Wyoming Behavioral Institute. So again, when it's a communal environment, it spreads a whole lot quicker.
And from what I understand, and correct me if I'm wrong, we have seen a couple of clusters here around the state. One, as you just mentioned, was Wyoming Behavioral Institute in Natrona County. I think they were a large proportion of the cases up in that area.
Right.
And then in Fremont County, from my understanding, wasn't a nursing home kind of the center of a lot of this?
Yeah, it was. It was a nursing home that, and I don't know if they've ever figured out exactly how it got there, who actually brought it in, or, if it was staff or a visitor or what. But because that's such a closed population, it spread, and because they're very much at risk, it spread very quickly in that institution. Luckily for them, however, they've not had any deaths, which we're really happy about.
Now, one thing I was surprised about the other day, and I don't remember if this was statewide or if it was Laramie County, so you may have the information on that, but the second largest group of people suffering from the infections from this disease was people in their 20s. Now, I don't know if that was locally or statewide, but that kind of was counter of what we've all expected, that this mostly infects older people. Am I right, and are you familiar with what I'm talking about?
Yeah, it's been really interesting, the data on ages. I was looking at some data, statewide data the other day, and 30% of our cases are people over 59, which means 70% are under. And our group around the 30s and 40s is the highest. So that's not typical of what we've seen in other countries. And I haven't had a chance to look at how that compares with other states, but it's definitely not what we anticipated was going to happen. We really were looking at the older group as being the highest risk group. Now, it could be because people who are younger are thinking, well, I'm younger, there's no way I'm going to get this. And so maybe they haven't been as diligent as they should have been. Mm-hmm. But in the state, it really is that group under 50 or under 59 that are the highest numbers.
Okay, I'm speaking with Kathy Emmons, Director of Cheyenne-Laramie County Public Health. Kathy, it looks like we have a caller. And okay. Good morning. You're on the air. Did you have a question or comment for Kathy Emmons?
Yeah, Kathy, I was looking at your COVID-19 page on the website there for the Wyoming Department of Health, and I noticed that I love that green line that you have there now because it calculates and records the number of the active lab-confirmed cases now. The active ones. That is so hopeful and helpful because the active is only 148 cases, whereas the confirmed number, that's going to just keep growing and growing, right?
Well, we should.
It's cumulative. Well, it's cumulative. And so that number will just keep growing and growing. It will never go down because it's cumulative, right?
Right.
The total number of confirmed. Right.
Exactly.
Well, the active cases is you take the recovered number of cases and you subtract the recovered number of cases from the total confirmed cases, right? And exactly. I think that's 148 right now.
Yeah, so
right?
When you look
it's
total number,
so
and then you track.
Yeah, eventually is that green line for the recovered cases that's going to catch up with and connect to the confirmed cases, right?
Kathy,
except for, of course,
Kathy, go ahead and answer
people
the
who
question
die.
if you may. Go ahead.
So if you look at the total number, there should be data on there for both recovered and active. So
it is.
If you add the two together, that's going to give you your total number. So our hope is that our number of recovered continues to go up.
Right, that's that green line
with the mortality. Right.
Yeah, and that's that green line. So eventually the green line will touch the blue line. But that blue line is never, ever going to go down because it's cumulative. It's just keeping a total of all of the cases so far.
Exactly.
Going forward.
Yep.
Right. So that's kind of an alarming line to look at if we don't have something to compare it to, like the active cases.
Mm-hmm.
Yeah. Could you put another button that actually calculates the active cases so people don't have to go in and do that math by themselves?
You know, and that comes from the State Department of Health, and I know that that's a request that they've had in the past. Excuse me. That's a request they've had in the past, so hopefully that's something that they'll be able to do.
Can you bring any urgency to that request on the part of people?
Again. Yep. I will
Thank you.
That on
Okay.
Thank you very much. Goodbye.
Thanks for the call. Appreciate it.
Thank you.
Now, again, I'm speaking with Kathy Emmons, Director of Cheyenne-Laramie County Public Health. Kathy, one good thing as a layman, I guess, and again, correct me if I'm wrong here, is we're not seeing our local medical facilities just overwhelmed with cases as of yet. Am I correct on that?
Yeah, and that's been so positive. Right now, well, as of yesterday, we had 5 cases that were hospitalized. 2 of those were on respirators, and 3 of them were in the floor that they've designated for the COVID floor. But yeah, the numbers that we've seen in the hospital are nowhere near what we were afraid they were going to be. So that's been real positive.
But we don't know that might not happen yet, correct?
Yeah, I anticipate we will have more hospitalizations. I would just be incredibly surprised based on the trends in other places, including our neighboring states. We are anticipating that. And in fact, we are even preparing for what would happen if we were to have a surge. So we're looking at some alternative options for how to take care of a large number of hospitalized patients.
What might be some of those alternative options?
So one of the things that we've done is we're working with the Army Corps of Engineers, and they came into Cheyenne, I think it was 2 weeks ago, and we had them look at a couple of different facilities to see if they would be appropriate for standing up a medical surge unit. And we're still waiting on all of the results back from them. But what they would do is come in, set up units for us, help us get everything stood up as far as the beds, the medical equipment, all those kinds of things. And then the community would have to staff it. But the Army Corps comes in and sets it up for us. They've done similar projects in New York, in California, in Washington State. So that's one of the things we've done. And we're also staying in close contact with the VA. They've offered to help take care of overflow patients if that becomes an issue.
Now, we talked earlier about the surprising number of younger people that seem to be contracting COVID-19 in Wyoming, and people in their 20s, which is kind of a surprise to, I think, what most people would have expected. Are there any other demographic patterns that seem to be not what we expected so far?
I don't really think so. The good thing about being on the back end of the wave is that we're able to see what's happened in other states. If you look at the genders, we're about 50-50. I know they're talking about people who are or have been smokers in the past. They have a much tougher time of this. If you've got more respiratory problems, that's going to be a challenge. But the rest of the demographics, I think, are pretty much what we expected. No big surprises there. Outside
of the people in their 20s getting more than we expected.
Right.
And that could be a case of overconfidence, I think we would say. Is that right?
Absolutely. When you're in your 20s, you kind of go about life thinking you're bulletproof and untouchable. And sometimes, that comes back to haunt you, unfortunately.
Well, I remember those days. You get a little bit older and you realize, unfortunately, that's not the case.
Yeah, that's so true.
So does it look like the social distancing measures we're taking are having an impact, however?
I think it does. And like I said, the numbers that we would have had we not been doing social distancing would have been far greater. I have no doubt at all, because we do have community spread. Once you get community spread, where you can't identify the source of the virus, one person can't identify where they got it. If you're not able to do social distancing, it's just going to go like wildfire. I've said before that we don't have a lot of tools to fight this virus. We don't have vaccines. We don't have antivirals. The one thing that we do have is the social distancing. It won't make it go away, but it'll sure slow it down a whole lot.
Now, there's been a lot of conversation nationally, and I'll probably pronounce this wrong, but you'll know what I'm talking about, I think, about a drug called chloroquine, and I believe that, in fact, South Dakota is doing a trial on that. Is there much hope for that being effective, or do we know?
There's mixed reviews. I've read positive and I've read negative. And I think you're right that South Dakota is looking at using it widespread as an antiviral, kind of like a Tamiflu. I understand that some hospitals are using it just as a general first-line defense for COVID-positive patients, but I think it's still really up in the air as to the effectiveness. And then also, whenever you're looking at these kind of drugs, you have to look at the side effects too. One drug is not going to react with every person the same. So we really have to have some more information on side effects and how it does with people.
So we won't know that for a while, probably.
We won't, no. That's the bad thing about this is, you can jump to an antiviral, but if you don't have the research, the damages can be as bad, if not worse, than the benefits. And when you're dealing with humans, you just don't know what's going to happen, which is why trials, unfortunately, take so long. But that's the only way to get good research.
And here in this country, sometimes I remember reading about the thalidomide problem in the past when we authorized a drug that we thought was perfectly fine, and it turned out it had some horrendous effects. In this case, in terms of birth defects, and that's always something we need to be conscious of, right?
Absolutely, yeah. That's a perfect example. We thought that was a great treatment for morning sickness, and turned out, like you said, to have just absolutely horrific side effects.
Now, Kathy, we also hear a lot of talks about a vaccine. Some people say that could be a long ways off. Some people say that maybe it'll never happen. What do you think the prospects are on that?
Boy, I don't know. I'm not a scientist. I would guess that we will be able to come up with something close. What usually happens with the vaccines is they're able to study what happened in the previous years. For instance, with the flu cycle, we look at the symptoms and the lab studies from the previous year, and that data is used to develop the vaccines for the next year. But again, you got to have a fairly substantial amount of data to work with. So I'm hoping that we can come up with a vaccine. There's a lot of scientists working on it. There's a lot of really smart people that are digging into it. So I'm hopeful that we'll be able to find something. And I know they're even talking about the potential of not only a vaccine, a shot, but potentially pills as some type of a vaccine. So when that happens, we will, at the Public Health, will definitely be geared up to help make sure that we can provide those resources.
But sadly, that's probably a ways off, am I right?
Yeah, I'm guessing it's at least a year off, maybe longer.
Now, another thing I've read a lot about, and I know a lot of this stuff we just don't know the answer to, but I'll ask it anyway. There's a lot of talk about a second wave in the fall. What do you think the prospects are of that?
Well, that's really interesting, too. We look at the influenza of 1918, the Spanish flu, and again, with these kinds of situations, all you have to go on is what's happened in the past with similar viruses. When you look at what happened with the Spanish flu, that's exactly what happened. They had the first wave, people got through it, thought that it had passed and everyone was okay, and then had another wave about a year later. So again, that's something that we're going to have to really stay diligent about. The good thing now is that we've got so much better research facilities and information available, obviously, than we did in 1918. But there's a real possibility that we could have a second wave of this.
How did the Spanish flu pandemic come to an end? Did we come up with a vaccine? Did it just play out, or how did that work?
Well, it lasted about 2.5 years. And again, it was a pandemic all around the world, and it went in a couple of different waves. And it lasted, like I said, about 2.5 years. They had 2 or 3 waves, and eventually it just kind of burned itself out, because what the virus does is continues to morph and evolve, and eventually they felt like it just almost turned on itself and burned through. And some of it, too, was people began to get some immunities toward it, or, to it. So that was helpful. But it was a terrible process for them to get through.
Do we think the COVID-19 will follow a similar pattern, or is there any way to know that?
I don't think there's any way to know that at this point.
Well,
that's the really hard thing about this. There's 2 things that I think make it incredibly challenging. One is the information just keeps changing and evolving. So what you think will work today may not work tomorrow. And the second thing is that we just don't have a lot to go on at this point. We just don't have enough information to make good scientific decisions.
So all we can really do as individuals is keep washing our hands, practicing social distancing, and hope for the best, pretty much?
Mm-hmm. Well, and now, the CDC has recommended that if you're in public, make sure you wear a mask. It does not have to be an N95 mask. We still want to reserve those for the healthcare providers because they need those desperately when they're caring for patients who are COVID-19 positive. But CDC does recommend wearing a cloth or a surgical mask when you're in public as just another layer of defense.
Now, is that a defense for other people from getting the bug from us or us from them or both?
I think it's really both. Originally, the information was that if you wear a mask and you're sick, it's going to keep it from infecting other people. Now they're saying, it's just another layer of defense for everyone. I'm not sure exactly how much scientific research, again, is behind that. I've not really seen a huge amount from CDC, but I think we're looking at it really as just another barrier.
There's so much about this. We're really kind of feeling our way in the dark, so to speak, because there's no recent precedent for this. Am I right?
Absolutely. Absolutely.
Okay, I'm speaking with Kathy Emmons, Director of Cheyenne-Laramie County Public Health. If you have any questions or comments, 632-6500 is open. We're down to just a few minutes, so I would ask that any calls keep it relatively short. But if you do have any questions or comments, that phone line is open. Kathy, can we learn anything from what we've seen, say, in Colorado, where there's a much more widespread pandemic? Can we garner anything about that from what we may face in Wyoming or not?
Well, I think probably the biggest thing is in a more dense population environment, you can see how much quicker it spread. Other than that, I'm not really sure that I've not seen anything that's significantly different than other states, but boy, it moved quick in Colorado.
Now, of course, there's a fairly significant outbreak in Weld County right down the road, too. So looks like we do have a caller. Good morning, caller. You're on the air.
Good morning, Doug. This is Lisa.
Hey, Lisa.
I just wanted to let people know, I know he's a celebrity, but he's a real doctor, too. Dr. Oz. He's doing an informal research on that malaria drug that I can't pronounce either.
I can't either.
But he has a far reach. He reaches all across the country and probably around the world, seeking information of people that have had firsthand experience with that medication. So that might be a place that your guest may want to look at.
Kathy, any comment on that?
I'm not really familiar with what he's doing right now. Unfortunately, this dealing with the whole COVID-19 has taken me away from being able to watch much TV or news or anything. So I know there are things going on out there that with some physicians that I am missing out on. So.
Well, I can understand that, but you might want to just check out his website.
Yep, thank you.
Thanks, Lisa.
Bye-bye.
Now, Kathy, we're down to about a minute and a half left. I think I covered most of the questions. I did want to ask, just from your observation, are people in Laramie County doing a pretty good job of social distancing and doing what they need to do, or do you think we're a little slack on that, or do we know?
I think right now people are doing a good job, with the exception of a few pockets that we've seen. But I think people are trying their best, trying to do the very best they can, and are working hard to stay distanced. So I feel pretty good about that. I think the challenge is going to be as other states start to loosen up, because they were so much further ahead of us, people here are going to get antsy and want to do the same thing. And we have to remember that we were several weeks behind some of those hotspot states. So it's going to be a little bit longer here than it was in New York or California or places like that.
In the meantime, Kathy, I guess all we can really do is just keep on keeping on and do the best we can and hope for the best.
Yep, stay safe.
Stay safe, okay. You guys do have a website, by the way, where you put out some information, right?
We do. If you go to Laramie County, and then you can go into the health department from the Laramie County website. We've got lots of information there, and then also on Facebook, we try to keep lots of current information up there also.
Okay, I'd like to thank my guest. I've been speaking with Cheyenne-Laramie County Public Health Director Kathy Emmons. Thanks, Kathy.